Solving a puzzle can be tricky. So many pieces look the same, with similar shapes and colors. But each piece has its own unique design and place in the bigger picture. In the fight for patients living with lung cancer, one mutation has been one of the toughest puzzles to take on.
When I first heard that we were developing a program for KRAS G12C mutant cancers, I actually had chills because I knew that this had been this 40-year struggle.
For 40 years, researchers have studied KRAS protein mutations, nearly half of which are a type called KRAS G12C. This genetic mutation, also called a biomarker, is one of the most prevalent, occurring in 1 in 8 Americans living with the most common type of non-small cell lung cancer. But here's the thing. Many proteins have a lumpy, irregular shape with many cracks and crevices for drugs to lock in and take hold. The challenge is that KRAS G12C has a smooth and round shape, like a tennis ball. This makes it difficult for any drug compounds to latch on and stop it from causing cancer. For patients with this biomarker, targeted treatment options have been non-existent until recently. But finding a missing puzzle piece requires perseverance, lots of it. In 2013, researchers discovered a groove in the smooth surface of the protein, the switch II pocket. This pocket was the first sign that maybe this mutated gene could be druggable after all. Working together, parts of the puzzle can come together faster, and there's not a moment to lose. When Amgen explored the switch II pocket, they found another groove, the H95 pocket, yet another foothold for a drug to potentially attach to the mutation.
Our research team at Amgen recognized the importance of this discovery. 2 grooves meant more opportunity for the drug to attach to the mutated protein.
With these pockets identified, the search was on for this key piece of the puzzle, the right drug that could fit into those pockets.
We needed to find a drug candidate to come in at precisely an exact location and be exquisitely positioned to grab onto the KRAS protein. This was a key priority for us.
Fortunately, Amgen was able to evaluate published research and theories and combine that work with their own scientific research to identify a viable drug candidate targeting KRAS G12C. This key puzzle piece fit into place and was able to inhibit the mutant protein from driving cancer cell growth.
KRAS acts as a master switch, turning on and off cell division. Our drug candidate traps KRAS in the off position, holding it in the inactive form and stopping tumor growth.
So when we finally were able to identify that ultimate candidate molecule, it was truly such a celebration because we knew that this was something that could potentially be a paradigm-changing milestone.
In 2018, Amgen was the first to get a KRAS G12C inhibitor into clinical trials.
We started with the end in mind, which was to get this drug to patients. We did this within 3 years. And 3 years was from the time of the first patient dosed to the actual FDA approval. That was truly breaking the glass because the typical paradigm for drug development is approximately 10 years. And we did that by accelerating every step of the way, from candidate identification, toxicology, trial enrollment, and registration, with the whole end in mind of trying to get this drug to patients with KRAS G12C mutant cancers as quickly as possible.
What started as an impossible puzzle is now a clearer picture with the pieces falling into place. The determination of researchers and their commitment to patients led to this breakthrough targeted treatment for people living with KRAS G12C mutated non-small cell lung cancer. These accomplishments are never one person's alone, and Amgen's discovery has been built off previous researchers' work. Amgen is proud to be the first to drug what was considered the undruggable. While this is a major step forward for cancer research, there are still many more puzzles to piece together. What is Lumakras? Lumakras, sotorasib, is a prescription medicine used to treat adults with non-small cell lung cancer, NSCLC, that has spread to other parts of the body or cannot be removed by surgery, and whose tumor has an abnormal KRAS G12C gene, and who have received at least one prior treatment for their cancer. Your healthcare provider will perform a test to make sure that Lumakras is right for you. It is not known if Lumakras is safe and effective in children. Important safety information. What should I tell my healthcare provider before taking Lumakras? Before taking Lumakras, tell your healthcare provider about all your medical conditions, including if you have liver problems, have lung or breathing problems other than lung cancer, are pregnant or plan to become pregnant. It is not known if Lumakras will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if Lumakras passes into your breast milk. Do not breastfeed during treatment with Lumakras and for 1 week after the final dose. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, dietary, and herbal supplements. Lumakras can affect the way some other medicines work, and some other medicines can affect the way Lumakras works. Especially tell your healthcare provider if you take antacid medicines, including proton pump inhibitor, PPI, medicines, or H2 blockers during treatment with Lumakras. Ask your healthcare provider if you are not sure. Lumakras may cause serious side effects, including liver problems. Lumakras may cause abnormal liver blood test results. Your healthcare provider should do blood tests before starting and during treatment with Lumakras to check your liver function. Tell your healthcare provider right away if you get any signs or symptoms of liver problems, including your skin or the white part of your eyes turns yellow, jaundice, dark or tea-colored urine, light-colored stools, bowel movements, tiredness or weakness, nausea or vomiting, bleeding or bruising, loss of appetite, and pain, aching, or tenderness on the right side of your stomach area, abdomen, lung or breathing problems. Lumakras may cause inflammation of the lungs that can lead to death. Tell your healthcare provider or get emergency medical help right away if you have new or worsening shortness of breath, cough, or fever. Your healthcare provider may change your dose, temporarily stop, or permanently stop treatment with Lumakras if you develop side effects. The most common side effects. The most common side effects of Lumakras include diarrhea, muscle or bone pain, nausea, tiredness, liver problems, cough, changes in liver function tests, and changes in certain blood tests. These are not all the possible side effects of Lumakras. Call your doctor for medical advice about side effects. Please see full Lumakras patient information